Old Alabama gardener. In this video, I'm talking about how to get blood tests without doctor's orders. Now I'm going to do something a little bit different here. I'm going to show you the chart that I'm putting on the screen, and then I'll talk about it. And the reason I do that this way is so that I'll be sure that I'm talking about the same chart that you're seeing. You have to do this. This is called a disclaimer. And so this is something I do because I don't want you to think that I'm a doctor. This video is a continuation of what would I do if I wanted to improve my health. And so I'm going to explain what I've done, and then you can copy it and use it if you want to. Now I'm really talking about doing more than just what your doctor says. You can do a lot of stuff for your own self. Now in my first video on this, in the comment section, a person asked me about the various tests, actually the laboratories that do the test, and how would they find them and know how to get their tests done and things like that. So in this video, that's what we're going to talk about. So on the road to better health, you start out with some simple little tests. You get them done so you can establish what's called a baseline, or in other words, a beginning point. Then, based on those numbers, you make some lifestyle changes. It might be quit smoking. It might be quit alcohol. It might be changing how you eat. Lifestyle changes. Remember, only 20% of what happens to you is genetics, and 80% of what happens to you in terms of health is lifestyle, stuff that you do to yourself. So then you go along with this lifestyle process, and after a while, you do the test again. Now it's important that you do the exact same test. Otherwise, you won't have something to compare it against. And then, based on those results, you might need to make some more lifestyle changes. So you keep repeating this process over months or even years. Blood test, who knows? So anyhow, you can do your own blood test and a urine test. And there's a few more tests too, but maybe we'll talk about them later, without a doctor's orders. And I'm going to show you how. Now this is a list of the laboratories that I know of where you can get blood tests and urine tests, and like I said, a couple other tests ran without a doctor's orders. Now that the writing here is pretty small, I know. So what I'll do is I will list all these in the description box below this video with a clickable link for you so you could go there. Now you might see over here on this side here, I got 2 or 3 of them that has a red asterisk. So those are ones that I personally have used. So now let's get into how do you get these tests. Well, the first step is to figure out what kind of test do you want. Now, if you're dealing with a specific disease or illness, you might need to start with a specific test. But if you are just looking to improve your overall health, maybe just a basic panel, they call them panels, will be what you would want. Maybe it's a metabolic panel about how your whole body's working, or a panel on how much minerals you have in your blood and your body and things like that. So the first test is just to determine what kind of, the first step is to determine what kind of tests do you want. That's what I said right up here. And then you'll want to look at the different laboratories to see if they offer that kind of test. Some of them do and some of them don't. And you can also compare prices. So you might find two laboratories offering the exact same test with a little bit different price. Now here's an important point. Make sure that the laboratory you choose is located in a city near you. I know you're not going to be wanting to drive hours to get to a laboratory. Most major cities are going to have one or more of these laboratories. So I'll talk a little bit more about that. Now, I just said that not all labs offer the same test, and not all of them have the same prices. So you're going to basically do shopping comparison. We do that with lots of other things, and you can do that here too. Now, there is an important thought here. You can get just a single test. For example, you might be able to get a test on white blood cells. And there may be times when you would want to zero in to that level. And I'll give you a quick example. You might want to know your C-reactive protein, which is a measure of inflammation in the body. Okay, so you can get just one single test for C-reactive protein. Or you can get C-reactive protein as a part of other tests called a panel on inflammation. So it depends on which way you want to go. Now you're going to do these test orders on the internet. So what's the next step? Well, once you have looked at the various labs, chose what tests you want, then you're going to actually do the order online, on the internet, at that particular lab's web page. And of course, they're not going to do it for free, so you got to pay for it. And then once you do that, and it's accepted, and it will be accepted as long as you pay for it, the lab will send you an email with a lab request. Or in other words, it's like a lab order. And that's going to tell the lab what test you want. So what do you want to do next then? Once you get that lab request in your email, I would print it out in hard paper copy, just like these are here. And then I would call that laboratory, because in there will be a telephone number for them. I would call that laboratory and get some instructions. For example, it might be that you don't eat anything for 12 hours before the test. Or it might be there are some tests that are tested for certain things, and you wouldn't want to eat, say, fish, or take a fish oil supplement for 12 hours prior to getting the test done, because it will make your test numbers be not the average, but it'll skew the test numbers. So then the next step is you go to that lab. Now, up here on calling the lab, it might be that you need to set up an appointment, especially right now with this coronavirus thing that was going on. So you need to call the lab, tell them what kind of test you're taking. They'll also have a copy of it. And they'll have a copy that says that you paid for it too. So you go into the lab, and you get you tests done, whether it be a blood draw, urine test, or whatever. All right, so now how do you get your test results? Well, once a lab has processed it, and it won't take them long either, usually 2 or 3 days, it's going to be a lot quicker than when you go to a regular doctor's office. The lab will send you in an email with the lab report, usually as an attachment. So you pull that attachment off of the email. Now, what do you do once you have the test report in your hands? But the thing you want to do next, is have somebody help you understand what those numbers mean. So there's one outfit that I use occasionally, and they're called Life Extension. And so if you do your lab work with them, they will have a copy of it, of your lab results, and you can call them up on telephone and actually discuss what those numbers mean, and they will give you some ideas about what you need to do in order to improve those numbers. So that's a helpful thing there too. Now, once you do this a little bit, you'll get to where you're starting to know more about them numbers than you probably know now. The other option is you can do research online. You can type in a Google search the lab item line, and you'll find a whole lot of information on what that lab report item means, and you might even find some help about what to do about it. Now I want to talk about this just a little bit. When you do a lab order or a blood test and you get the results, that's just a snapshot in time. That's one data point. It tells you something, and it is valuable information, but it doesn't give you a trend of whether you're staying the same, getting better, or getting worse. In order to get that kind of a trend, you have to do multiple, over months or years, tests, and then you can compare those numbers with the previous ones, and you'll know whether you're getting better or worse or staying the same. So having a trend is super, super important. And later on in another video, I'll show you some trends of my stuff over a number of tests that'll show you how this works. So I talked about that just a little bit here. So you get trend data by doing the exact same test over different times. Some things that you might do, you can get results within 3 months. Some other things may take longer. Depends on what's going on and how much changes you might make. And I'll talk later in another video about some of the things I did where I made changes in 3 months. Significant change in 3 months on some of my test report. So let me do just a little quick recap now on what we've talked about. So your first step was you decided which test you were going to get. Second step was you selected a lab in your area where you were going to do those tests. Then the fourth step was you get the test done and then you get the results. And 5, you analyze the numbers. See whether you're within the ranges or out of the ranges. So once you've made all this test, you did these tests, then you have made some lifestyle changes, then you're going to retest again. Because if you don't retest, you won't know whether you improved, stayed the same, or got worse. So you have to retest it. So then you will compare the next test or the second test with the first test. And that way you're going to see the numbers go up, down, or stay the same. So that means that you'll know then, you got 2 data points then, you start to see a little bit of a trend. You can tell whether you're getting better, staying the same, or getting worse. So the point is that now you're collecting trend data, and the next time you do another test, the exact same thing, you'll have more data points, which you'll see your trend even better, and you keep that up. And that's how you make improvements in your health. You do the test, you analyze the data, you compare it to previous data, you make lifestyle changes, you wait some period of months with those lifestyle changes, and you do that same test again. That's how you improve your health.